In vitro fertilization, or IVF, has become increasingly popular for families that face trouble conceiving naturally. A second practice that has stemmed from this is PGD, pre-implantation genetic diagnosis. This allows doctors to know certain traits of the embryo, like gender and whether it carries genes for certain diseases or abnormalities. This allows parents to choose the embryos that are implanted into the womb based on their traits. This practice has gained popularity with celebrities like Chrissy Teigen and John Legend choosing the genders of their children and has stirred up controversy as well. Limited government regulations, high prices, and religious conflicts are just a few of the public concerns surrounding this procedure. IVF is a procedure that helps a mother get pregnant when one or both parents has infertility issues. It consists of the retrieval of eggs from the mother, those eggs being fertilized in a lab, and lastly, being reimplanted into the womb. In addition to IVF, parents can choose to have PGD as well, which is a technology that allows genetic testing of an embryo prior to implantation. It is used in conjunction with IVF and allows certain embryos to be transferred into a woman based on gender preference and/or medical diagnosis. During PGD, the embryos obtained during IVF are tested for abnormalities and gender. Once this information is obtained, depending on the preferences of the parents, the embryos of the desired gender are then transferred into the woman. Following this, the pregnancy will continue as normal and is closely monitored to ensure proper growth and limited health risks. The cost of the procedure is substantial, which may deter those of lower socioeconomic backgrounds from having access to it. Price varies from clinic to clinic, but the entire process of choosing embryos of a certain gender costs between $20,000 and $30,000 for one cycle. This cost is broken up by different parts of the process. In addition to fees for pre-cycle screening and fertility medications, the basic IVF procedure costs about $15,000, and PGD costs another $6,000 to $12,000. If the mother does not get pregnant from the first cycle, additional cycles may be needed, each costing another $20,000 to $30,000. Parents are willing to pay huge amounts for IVF and PGD, making the industry grow rapidly. In 2012, gender selection made revenues of at least $100 million. There has been a discussion investigating the pros and cons as well. Some of the pros for this practice include preventing babies from inheriting health risks, increasing intelligence, and choosing desirable traits. In some cases, IVF can reduce the risk of miscarriages as well. On the other hand, there are some against the practice because of possible risks for the mother, such as ovarian hyperstimulation syndrome and multiple pregnancy. The risk of birth defects is heightened in IVF procedures, yet is reduced with PGD if the parents are able to afford the extra cost. Some also speculate the long-term evolutionary and societal damage, as well as the possible negative mental effects for the children. Choosing traits for the next generation would put a halt to natural human evolution, which could lead to some undesirable outcomes. If humans were all resistant to the same diseases and a new disease enters our society, no one would have a strong immune system to fight it off. It is also possible that the knowledge that they were designed could have a negative impact on the child's mental health. They may feel an increased need to live up to their parents' expectations and not be their true selves. Additionally, if scientists and doctors are able to help parents handpick traits such as intelligence and athleticism, a superior society may arise, and with that brings many ethical questions and dilemmas. Public opinion is quite split on this subject. Those who are supportive of the practice believe that parents have the right to choose the gender of their baby. Many supporters argue that if this life-saving technology is available, there should be no question not to use it. 72% of Americans approve of using this technology to prevent disease and birth defects. However, there are many who oppose it as well. Some religious beliefs conflict with the practice because it goes against God's design. Some foresee the potential negative effects it could mean for the country, such as the creation of a genetically superior upper class. 80% of Americans oppose using this technology to make babies smarter. There are those who are in between as well. Some support PGD for detection and removal of embryos that will have fatal diseases or lifelong disabilities, but not for gender selection or choosing mental or physical traits. Because the practice is so new, there are few official regulations for it. At this time, doctors are not allowed to use PGD or IVF solely for gender selection purposes. Parents must need IVF for other reasons, such as fertility issues, to be able to use PGD to choose traits for their baby. In 2015, the U.S. Congress banned human testing of gene editing techniques that could produce genetically modified babies. It is not permitted to edit the genes of embryos that will be implanted back into the mother. Doctors can only choose embryos with desired traits from the pool of embryos that are available. However, laboratory research, including gene editing on embryos that will never be implanted, is allowed. The FDA's ban on gene editing is only applicable for embryos that will be implanted to become an actual human being. The introduction of PGD can cause radical changes for American society in the future. The large cost of the procedure could lead to only wealthy people having access to desirable genes such as disease resistance, athleticism, and intelligence. Children born naturally will be at a disadvantage from birth because their parents could not afford to give them traits that are desirable in society. In a society where intelligence is bought, what does it mean to be smart? Does being smart just mean that your parents are rich? Earning the title of top student in their class would no longer be the result of hard work. It would be predetermined at the time of the student's birth. Society could become segregated into two classes, those with the superior genes and those without. This can lead to discrimination and lack of equality. Because those with superior intelligence would have higher paying jobs, they could then guarantee the same for their children. That would leave the poor never being able to get ahead and get the higher paying jobs to pay for PGD for their children. PGD could lead to a very divided America in the future. It could also lead to a radically increased lifespan of humans. People could become completely disease resistant, making the only cause of death accidents and old age. This would lead to a boom in world population and a lack of resources to go around and to sustain it. However, increased regulations and limitations could prevent these negative outcomes from becoming a reality.